And whether we're talking about the meeting yesterday I had with the Vice President in the cruise industry, how do we make sure that the people that are going on cruises are safe, and we know how to deal with somebody that might end up with coronavirus, or just how we make sure we're completely transparent in every community. My goal is in every community that we are giving people as much information possible so that they can make the best decisions. When I was governor, I always thought about in the hurricanes, and then we had Zika, of course, is say, prepare for the worst and hope for the best. And if you look at everybody up here, that's exactly their attitude. They want to take care of people. So I think the way you take care of people is you give the public all the information you can and let them make good decisions, which I think they will. So I've been clear. I think when we have cases, we ought to be able to put out as much information about those cases as we can. We know we have some limitations because of HIPAA, but if we're telling people as they're that if you have this type of chronic condition, you shouldn't get on an airplane or go on a cruise, the more information we can give people, there's a better chance they can relate to it. Also, our airports, are clearly they're focused on make sure we have a great experience for our passengers. If somebody's on one of our flights and they end up with the coronavirus, I'd want to be contacted. I want somebody to call and tell me that I should take some precautions, possibly. And so I think all of us believe that way. So I've informed everybody here, and we have a good working relationship that I'm going to continue to do everything I can at the federal level to make sure all the federal agencies show up. As you all know, we passed an $8 billion funding bill last week just to deal with coronavirus. It's to do things such as make sure we get the vaccine, make sure we get the tests done as quickly as possible. I also believe that everybody ought to have access to a test. The non-government lab companies are starting to come out with their tests now, which will make it easier to make sure everybody can get tests. To go back on the cruise just for a second, the end of the meeting yesterday with the Vice President of the cruise industry is the cruise industry is focused on what they can do to keep people safe, and they're going to come back and be talking to the Vice President about what else they can do to make sure people are safe when they get on and they're safe when they get off, and we know how to work with it. So, Mayor,
all right.
Right this time.
Yes. Okay, we're done.
We're at the
port.
port.
Yes, and we are focused, as we have said. My time, 31 years at the police department. I always said that we work so closely here in the Tampa Bay area, and the same thing continues in my position as mayor. All of the first responders in constant communication, as with the port, with the airport, CBP, we've got everybody together working on this issue, ensuring that we're taking every steps that we can to prevent the spread of it. As we've said all along, this isn't an if, it's a when. And so what we're looking to do is to reduce the number of cases that we have here in the community and keep the public informed. And we have done that at the City of Tampa. We have Tampa Ready that can be texted to 888-777. And then for our Spanish-speaking community, we have Tampa Lista to 888-777. I did a Facebook Live the other day for a Spanish-speaking television station that was broadcast worldwide, and we got questions from all over the United States and from Puerto Rico. So again, making sure that our community, our residents are informed, and that we are all working together to ensure that all of our citizens are safe.
Thank you. Yeah, the Tampa International Airport is very focused right now on disinfection, cleaning, and so on. We've doubled our hand sanitizer stations. We've hired more staff to clean the touch spots, such as handrails or the buttons on elevators, and so on. We put a lot of signage to tell people how to prevent catching a virus. There's a lot of protocols. It's very simple: hand washing, covering your sneeze, and so on. And so we've put that out. But I think the mayor and the senator, we're talking about the need for more communications. We are doing that at the airport, and we're trying to get the word out that we are cleaning and we're safe. Thank you.
Yeah, I want to thank Senator Scott for being here today to convey what transpired yesterday with Vice President Pence and the cruise line CEOs. They have tasked the cruise lines, which we have been in touch with several today, to be partners in finding some solutions. And as Mayor Castor, who is also just a terrific partner at the city, we have been in close touch during the week to find solutions working together and then put that out. At the port, we are the terminal for these cruise ships to be using. We've been always had protocols in place for cleaning the terminals. We've increased those. We're using some new products and processes to help those be as sanitized as possible. Our turnover is not quite the same as it is at the airport in the pace of operations, so we have time in between cruises to fully clean those terminals. We will do so. We have trained our facilities and our janitorial third-party services how to update. We have done all of the protocols. I'm not going to repeat here because they're repeated virtually on every leader that's been up here and every source, that using those common sense protocols to keep your hands free and all the things that you need to do. But we are fully aligned with the state, the federal, and our local partners here, and we're going to continue to do that.
U.S. Customs and Border Protection continues to support CDC's leading efforts. We continue to carry out their procedures, and we're here to support it anywhere we can, along with the state and locals. We're great partners in this, and it's no different than anything we've done before. Thank you.
I have to start, too, by reiterating again how grateful all of us are that Senator Scott took his time today to come out and sit down with us and make sure that we were aware of all the federal resources that are available to us. Wonderful sitting down with all the leaders here today, from the airport, the port, CBP, and our amazing mayor. It's great when we sit down and we have an opportunity to share resources. When we sit here and we share resources, all it does is make us better prepared. We're not at the level where we're sitting here telling you to go to an event, not to go to an event, go here, not go here. But we are saying that it's not time for widespread panic. If it was time to panic, we'd be the ones out in front of the cameras telling you, hey, don't do this, don't do that, or here's some restrictions or provisions that we have implemented. We're just not there yet. Contrary to a lot of the media wanting to build a lot of hype, we're just not there yet. I think that we have to remember that we are prepared. We have a very prepared response. We're doing everything that we can to make sure that we're preventing this virus from spreading, and that, again, we are prepared.
Senator? By the way, I think what Border Protection explained is, I don't know if you want to say anything else, but the decisions with around cruise ships and things like that is made by the CDC. They're the ones that make the decision on what happens with these cruise ships and when they come in and things like that. So it's not Border Protection.
How would you assess Governor DeSantis' handling of the coronavirus, thus far?
Well, look, I think everybody's learning about this. I'm never going to point fingers at anybody. I think at all levels, we're all learning a lot about the coronavirus and how to deal with it. I mean, we're watching, and you're watching what happened in Washington with the nursing homes, and I know everybody. If you're in the nursing home industry, you're learning. The cruise industry is learning. I think everybody's trying to figure out how do we, keep people informed and keep people safe.
Senator, we're dealing with the human condition here, which is totally unpredictable. I guess the public, the concern is, will things get worse before they get better?
Yeah. I hope not. I mean, that's, here's what, we don't know enough. Here's what's frustrating, I think, for everybody. This has been around now for 4 months in China. We know the information that came out of China is not great. So it's not, they're not a transparent country. They haven't been a great partner. But we do know that if you follow what when I was with the CDC director yesterday, and when you listen to them or Dr. Fauci at NIH or Dr. Red at CDC talk, the information that they're really getting a little bit more handle on is coming out of South Korea and out of Italy, which they're both countries that are transparent. So I think I think what they're saying and what they said yesterday when I was with them. If you have a chronic issue and your immune system is compromised, you ought to really stop and think about, should you be going on a cruise ship? Should you be flying? Where should you be? That's why I believe the more we can tell the public about the types of people, what issues they're dealing with, then it'll resonate with people. But my experience is at every level, people are trying to figure this out. But I really believe that the more information we give people, and it's part of what you guys do every day anyway, the more information we give people, people will make a good decision for their family.
Senator, how many cruise ships do we have off Florida's coast right now? And do we believe that there are cases aboard those ships?
I don't know how many we have off. Paul might know.
Well, yeah, I mean, Florida through Miami, Port Everglades, Port Canaveral, Jacksonville, and Tampa handles about 17+ million cruise passengers a year. So it's a critical industry and tourism where people come to Florida to visit, take a cruise. At any one time, I can't tell you, we have 2 cruise ships in today. We had 1 in yesterday. It is cruise season, the height of the cruise season. As far as the number of ships, I can't say specifically, but we are working with our federal partners again, and we're working.
So the conversation yesterday, here's some of the conversation. Here's a positive. A positive is because the companies like LabCorp are going to be able to come out with their tests. You're good. The belief yesterday in the discussion with the cruise industry was they're going to be able to do a lot of these testing while they're out at sea. They were working on trying to be very transparent about testing, about quarantining, about exactly what happens if they have a patient with this, and they're going to. And the commitment they made to the Vice President was by Tuesday they're going to come up with a unified plan. The nice thing about Florida, we have a lot of ports, and our port industry works really well together. And they not just work well together; they work well with the sheriff department, with the mayors, and with border protection. Everybody, Florida works really well together. And I hope we don't have an issue, but I believe if we do, everybody here, it's going to be all hands on board, and people will work together. But the cruise industry is going to come out and I think they're already doing it. They're putting up more stuff now, but they'll be even more transparent on Tuesday.
For that cruise ship that was stopped today by the CDC, do they currently have the test on board that they need?
The one in California?
No, the one that's here near the.
They are. I don't know that. I know what the goal. In the California when they were taking. Coast Guard was taking them out so they could do it, and so I know that they're trying to make sure that they're on the ships now, and the Coast Guard will take them out and get them out there. So I can just tell you, Mike, in being in the meeting yesterday, Coast Guard was there, CDC was there. Everybody's trying to figure this out, but But the other thing is we all have to understand we're all learning. I mean, we don't. This is not something that you say, oh yeah, this is the playbook, and we know exactly what to do, because we don't. We have to just be transparent as we do learn.
I was about to ask you that much like for a hurricane, we have a plan and a strategy and how we work with the different agencies and all that. Are we trying at this point to develop something?
There's a plan.
Have it. Yeah. We have it. We have all of those policies, procedures in place, and we exercise on a regular basis for those incidents, whether it be a hurricane, an active shooter, or a pandemic. We have that. All we have to do is figure out the nuances of what the situation is. But we are all in connection, whether it's health providers, first responders, the airports, the ports, transportation. We're all in constant communication, and we have all of those plans. It's just the nuances of the particular incident.
All right, thank you. Go ahead.
With regard to the airport, we know the first case involved a young woman who had come back from the affected area of Italy. I guess who is responsible to say notify the other passengers on that plane if someone does test positive? Who's responsible for that, and what type of communication level is going on with the folks who might be okay?
So here, I'll just tell you what I was told yesterday. The CDC has been working with the airline industry to where if they are provided the information that somebody was on a flight, then the information the airline has as far as communication with, it's like email or cell phone, they're going to focus on reaching out to everybody. That's part of what they do. Now they have to have that information, and it's not something that the airport does itself. So it'd have to be coordination between everybody that's taking care of the patient.